Diabetic neuropathy is a common complication of diabetes, causing sexual dysfunction. This video explores interventions for diabetic neuropathy-related sexual dysfunction, explaining how they work and their effectiveness. By understanding these interventions, medical professionals can make informed treatment decisions for diabetic patients. Viagra, sildenafil, is a medication used for erectile dysfunction. It increases blood flow to the erectile tissue by inhibiting the enzyme phosphodiesterase type 5. While it may help with sexual dysfunction in diabetic neuropathy, it does not treat the underlying symptoms of neuropathy. Pramipexole is a dopamine agonist primarily used for the treatment of Parkinson's disease, but emerging evidence suggests its potential role in managing chronic pain conditions, including diabetic neuropathy-related sexual dysfunction. This medication acts on the dopamine D2 and D3 receptors, modulating dopamine levels in the brain. By increasing dopamine release, pramipexole may enhance pain threshold and improve sexual function in diabetic patients with neuropathy. However, more clinical trials are needed to establish its efficacy and safety profile specifically in this population. Amitriptyline is a tricyclic antidepressant widely used as a first-line treatment for various forms of neuropathic pain, including diabetic neuropathy. Its mechanism of action involves inhibiting the reuptake of serotonin and norepinephrine, thereby increasing their concentrations in the central nervous system. By modulating neurotransmitter activity, amitriptyline can reduce pain perception in diabetic neuropathy. However, it is crucial to consider potential side effects such as sedation, dry mouth, and constipation when prescribing amitriptyline to diabetic patients. Gabapentinoids, including gabapentin and pregabalin, have demonstrated efficacy in managing neuropathic pain associated with diabetic neuropathy. These medications primarily act by binding to the alpha-2 delta subunit of voltage-gated calcium channels in the central nervous system, reducing calcium influx and subsequently decreasing the release of excitatory neurotransmitters. Gabapentinoids have been shown to alleviate pain symptoms and improve quality of life in diabetic neuropathy patients. However, cautious monitoring is necessary, as side effects such as dizziness, drowsiness, and peripheral edema are possible. In cases of severe diabetic neuropathy pain that is refractory to other interventions, opioid analgesics may be considered. These medications work by binding to opioid receptors in the central and peripheral nervous systems, thereby reducing pain signals. However, due to the potential for dependence, abuse, and other adverse effects associated with long-term opioid use, their prescription should be carefully weighed against the benefits in diabetic neuropathy-related sexual dysfunction. Capsaicin, a compound derived from chili peppers, has been investigated for its analgesic properties in diabetic neuropathy.
When applied topically, capsaicin depletes substance P, a neurotransmitter involved in pain transmission, thus reducing pain perception.
Topical capsaicin formulations have shown some efficacy in relieving neuropathic pain symptoms. However, it is important to address the potential skin irritation and burning sensation that may develop upon application. Nerve growth factor, NGF, is a protein that plays a crucial role in the development and maintenance of sensory and sympathetic neurons. Research has shown that reduced levels of NGF contribute to the pathophysiology of diabetic neuropathy. Various approaches to increasing NGF levels in diabetic patients, such as recombinant NGF therapy and stem cell-derived NGF, are currently being explored. By promoting nerve regeneration and preventing further damage, NGF-based interventions hold promise in managing diabetic neuropathy-related sexual dysfunction. However, further research is needed to establish their long-term safety and efficacy. Sodium channel blockers, such as mexiletine and carbamazepine, are antiarrhythmic medications that have also been investigated for their potential role in neuropathic pain management. These medications work by inhibiting sodium channels, which are responsible for generating and propagating action potentials in neurons. By reducing aberrant neuronal firing in damaged nerves, sodium channel blockers can alleviate neuropathic pain associated with diabetic neuropathy. However, they may also produce adverse effects such as dizziness, nausea, and arrhythmias, so careful monitoring is necessary. Alpha-lipoic acid, ALA, is an antioxidant that has been studied for its potential neuroprotective effects in diabetic neuropathy. ALA may help reduce oxidative stress and improve mitochondrial function, thereby protecting nerve cells from damage. Clinical studies have shown that ALA supplementation can alleviate neuropathic pain and improve nerve conduction velocity in diabetic neuropathy patients. However, the optimal dosage and long-term benefits of ALA in managing diabetic neuropathy-related sexual dysfunction require further investigation. Duloxetine, a selective serotonin norepinephrine reuptake inhibitor, SNRI, has been approved for the treatment of diabetic peripheral neuropathy. Its mechanism of action involves increasing the availability of serotonin and norepinephrine, which can modulate pain transmission pathways and alleviate neuropathic pain. Duloxetine has demonstrated efficacy in reducing pain severity and improving physical functioning in diabetic neuropathy patients. However, adverse effects such as nausea, somnolence, and hepatotoxicity must be carefully monitored during treatment. Transcutaneous electrical nerve stimulation, TENS, is a non-invasive technique that involves placing electrodes on the skin to deliver low-voltage electrical pulses. These pulses stimulate sensory nerves and interfere with pain signals, providing temporary relief from neuropathic pain. TENS has shown promise in reducing pain intensity and increasing pain threshold in diabetic neuropathy patients. However, its efficacy may vary among individuals, and optimal parameters for TENS application require further investigation. Cannabinoids, such as tetrahydrocannabinol, THC, and cannabidiol, CBD, have been investigated for their potential analgesic properties in diabetic neuropathy. These compounds interact with the endocannabinoid system, modulating neurotransmitter release and reducing peripheral and central sensitization. Emerging evidence suggests that cannabinoids may alleviate neuropathic pain and improve quality of life in diabetic neuropathy patients. However, due to regulatory restrictions and potential psychotropic effects, further research is necessary to establish their safety and long-term efficacy. Managing diabetic neuropathy-related sexual dysfunction requires a comprehensive understanding of pathophysiology and treatment options. This video has explored interventions ranging from conventional medications like Viagra to emerging therapies like NGF-based interventions and cannabinoids. Careful consideration of treatment goals, patient characteristics, and potential side effects is crucial. Staying informed and tailoring treatment approaches can optimize outcomes for diabetic patients affected by neuropathy-related sexual dysfunction.